The qualities it takes to be a DSP would be compassion, dependability, caring, understanding, loyalty to the job, commitment to the people we support.
The most rewarding part of the job is really the people that we serve. It's the relationships that you have with individuals. You know you're making a difference in somebody's life.
What motivates me to come to work every day is them. I love every single one of them, and if I didn't love my job, I wouldn't come every day.
What motivates me to come into work every day is if I needed the help that they need, I would want someone to give it to me.
To be a successful, DSP, you definitely need to be flexible. Definitely need to be able to come in every day and adjust with the pace of what's going on for the day.
I come in, get them up, showers, some get bed baths, serve them breakfast. I just recently became med-surg. I was on meds this morning. That's a very difficult task in the mornings.
We try to stick to a schedule, but life in this field is constantly making adjustments.
Nationally, the U.S. Department of Health and Human Services has confirmed that there's a crisis in direct support, and that's due to increased life expectancy of individuals with developmental and intellectual disabilities, the aging of their family caregivers, increased needs for community and home-based services.
I would say the most challenging part is being understaffed. It's hard working, a 12-bed house with only having like 4 staff.
It takes time away from my kids to come here every day because we're short-staffed. I don't ever see my kids.
We use the term direct support professional because these people are professional. They're trained. It's a very highly qualified job.
I've been currently working as of August 2016 for 5 years. As a habilitation specialist, I require a degree. The earning salary that I get, it's not enough to pay off the student loans and to make a living. I can't even make a savings.
So many of these direct support professionals have to hold 2 or 3 jobs just in order to survive.
We have colleagues that leave, it hurts because colleagues that leave, they are good workers. We work together. But sometimes I ask them, why you guys leave? They said because they found a better job.
When the staff leaves, there's a void left in their lives. They take it personally. They don't understand why everybody keeps leaving them.
It has happened to me. When other people leave, it makes me feel sad because they're like, I'm very close to them and they're like part of my family.
One of the most touching events that I can remember is one time a direct support professional saved someone's life because she noticed she came down to breakfast without her earplugs in. What that meant is that person was sick, and it was an immediate sense that we need to have this person seen by a doctor. That direct support professional got it.
They support me a lot.
What do they do for you?
They help me. They cook my dinner when I need it, and they help me make sure I measure stuff.
We have these people's lives in our hands every day, from just getting them through the day, and a lot of times we're working short, new protocols are enacted. It's a lot, and it can become very overwhelming. And when you hear of different jobs where they don't have such a high responsibility in terms of people's lives in their hands, and they're getting paid $15, $16, $17 an hour. How are we not receiving that benefit when every day anything can happen to these guys and we have to answer?
Governor Cuomo, I would hope that you would understand the level of care and the level of responsibility that goes with being a DSP in New York State.
DSP should make a living wage because we have to spend more time with these folks than with our own families.
I love my job, but I also have to work a second job, and I don't want to leave because of my people we serve, because I would miss them.
If we did make a little bit more, we would be able to keep more, and then these guys would be able to, know who's going to come in and who's going to take care of them.
It isn't just people with disabilities that depend on us. It's their aging parents. It's their siblings who live out of state and other communities.
These individuals come to work day in and day out, morning, noon, and night, and take care of individuals who depend on them for their very ability to move around their homes, for their meals, for their sustenance, for their medications. Who more important than they to recognize the value of what they bring to the state?
DSPs need to make a living wage because we want to be able to have them here. We want them to be able to make good money, and we want them to be able to make a difference in our lives.